All right, Dr. Sam, welcome to the Postpartum Performance Podcast. Welcome to the show.
Thank you so much for having me, Lindsey.
I'm excited to have you here. We have some fun topics. Before we started recording, we already were going in on some good conversation. I was like, oh, we got to record this.
Seriously.
So good. So why don't you just go ahead and share a little bit about yourself and what you do for work and what you're passionate about.
Of course. Awesome. So my name's Samantha Dean Fauce. I am a prenatal chiropractor in Carlsbad, California, so not far from Dr. Lindsey's practice. And caring for pregnant mamas is really my passion. I'm in practice with my husband. We've been in practice here in Carlsbad for 6.5 years and really enjoying it. And it's been a really fun season right now for us as well, because we are expecting a baby in October. So here shortly, I'm 34 weeks. So it's been really fun to kind of be on like the receiving end of care and to really be able to understand my patients even more than I was able to, without experiencing pregnancy before. So, yeah.
Awesome. Very good. Well, we'll just jump right in. I actually wanted to ask you about that. So being a healthcare provider that specializes in working with women that are pregnant and postpartum and all of that, how it's given you a new perspective being pregnant yourself. What was maybe like one or two of like the most surprising things for you being pregnant, and then you're like, oh, so when they say this, that, or like anything like that?
Right. Well, I feel like one of the most surprising things for me has been, I don't know, as a care provider, a lot of times we're taking care of people who are like coming in with, aches and pains and things like that. And I feel like for myself, coming into pregnancy and, just the care that I've received throughout my pregnancy has really set me up for a good pregnancy. Like I have not been in any pain. I'm on my feet multiple hours a day, working 6 days a week. I guess it sort of reinforced like how important like being preventative and proactive is. And so when I give those recommendations to my patients now of, hey, yeah, I know like you probably don't want to see me every week, but the benefits of you doing that is versus every month is you're not coming in with raging sciatica, or things like that, because we're able to stay on top of it as your body continues to grow and progress, throughout your pregnancy. So I feel like that was something that I already recommended, but now like having the kind of firsthand experience is just like, I can be so much more confident in that recommendation. And just like, obviously it's your choice. I want to help you and empower you in like the best way possible, but like, these are my best recommendations and this is why, so that's been, something that's been kind of surprising. And then I know, like, I don't know, some of the, people come in talking about like being so fatigued, especially like in the first trimester. And I did experience some of that, that fatigue, which is just unreal. Like I thought I knew what they were talking about. I'm like, oh yeah, like you're so tired, right? You're growing a baby. Like, no, it's like next level. But I'm thankful that was, like first trimester. And then once that was over, I was like, oh, I feel kind of back to normal.
Like this isn't a forever thing.
Right. Exactly. And, obviously like every pregnancy is so different, even with the same mom from, one pregnancy to the next one. They can be, so different, but, just, I don't know, having a little bit of perspective, going through it myself has just been, it's been fun. And then it's also really fun because we take care of a lot of pregnant patients. So it's cool to kind of be going through this whole process with them, which has been
Yeah,
really, really, really awesome.
that
So
is so special.
yeah, it's fun. We always like yik yak and I get behind and I'm like, okay, I'll see you next week.
I gotta go.
Exactly. Exactly.
So, how did you even get into chiropractic care, especially within even that niche of kind of the prenatal and all of that type of treatment?
Of course. So I decided I wanted to be a chiropractor when I was 15. I had a pretty severe quad injury where I tore my quad, not a full, but pretty significant injury that was misdiagnosed and then kind of mismanaged. And I was played club soccer and then ended up going on and playing soccer through college. But that injury caused me like some hip problems and then lower back dysfunction, SI joint issues, and then knee pain on the other side. And so I was getting PT, which was like really, really, really beneficial. And I finally like kind of hit a plateau where I wasn't really continuing to get better. And then my leg was better, but like my back started getting worse and my SI joints were worse because I probably shouldn't have been participating in soccer at that time, but I still was just like kind of trying to manage an injury while you're still playing, which I don't suggest. And so, yeah, my dad took me to his chiropractor and I got adjusted for the first time when I was a sophomore in high school. And it was just such an amazing experience. I was like, oh, whoa, that was really awesome. I went through a treatment plan, over a couple of months and saw dramatic improvement. And honestly, I don't think I would have played soccer in college if it weren't for chiropractic care because I was in a lot of pain. Like no 15-year-old should be in back pain, no one really should, but
Yeah.
definitely not when you're 15 years old. And so I had always kind of been interested in health and wellness, and was like always kind of tended more towards like natural stuff, even though that wasn't really necessarily like my upbringing per se. But like I never liked taking medicine. Like I don't know why. And my chiropractor at the time was like she was young and newer in practice, like within probably the first 5 years, had just had a baby. And so I kind of saw her, what I thought was like, killing it, right?
Yeah.
I'm sure there were struggles and things like that. But I was like, oh my gosh, like she's a mom and she's working and like she had a day off in the middle of the week. And I was just like, oh, wow, like that's cool. Because the idea of going to like medical school really didn't appeal to me because I wanted to have a family.
Mhm.
And so, from there, I was just like, I think I want to do this. And so I talked to Dr. Amy, and, like asked her a lot more questions and she kind of mentored me. And then through college, I've been under chiropractic care consistently since I've been 15. And was able to play collegiate soccer. And I really attribute, chiropractic care to getting me to that point. And so when I went to school, I initially, because I came more from like the sports background, I thought I wanted to do more of like the sports med
Mhm.
kind of road. And then I'm not sure when in school it was, but maybe my second trimester of 10, I was introduced to like more family wellness care and like perinatal chiropractic. So chiropractic care, preconception, during pregnancy, and then postpartum, as well as caring for like babies and things like that. And it was just so mind blowing to me. I was like, oh my gosh, I didn't even really like know that this was a thing. And even though my chiropractor cared for other pregnant moms, it's just like I didn't know.
Mhm.
Um, and it was so appealing to me because I've always wanted to be a mom. And um, just it's such a tender, amazing time to be caring for women. And yeah, so that was kind of where that got started, and got involved in some clubs on campus, and then took a lot of seminars, because you learn like the basics in school, which I'm sure same with you, being a
Hmm.
pelvic floor specialist. You
Yeah.
learn maybe some stuff, but then you really have to go seek out
Yes.
the specific information. And so, yeah, I sought out that, and that's kind of what, led me down this path, which I love. It's just, it's so fun to be caring for, for patients during such a like transformational time in their life. So I really, really, really love it.
Oh, that's awesome. I can tell just from how you're talking about it. I can see the passion and
Yeah.
hear it in your voice. So when you mentioned, I wanted to touch back quick. What position did you play for soccer
So I was a
primarily?
left wing.
Okay. Okay.
Yeah. So I was a left midfielder, which I think it's an 11 now. They like totally,
They
I don't
changed because
know.
I
Yes.
was just like midfield and I was like stopper, which or like that they
Yes.
called us a stopper, and I was like, I was a
Uh-huh.
stopper or a sweeper, like depending
Yep.
on, but yeah, midfield.
Yeah.
I'll just say
Yes.
mid.
Yeah, exactly. It's so
That
crazy
was
because
my
I've
spot.
coached little girls, and like it's so different how they like name the positions now. They're just like numbers. I'm like, oh,
Interesting.
I need to learn a whole new system.
Yeah.
But
All of those things are just switching it up on us.
yes, seriously.
But you had mentioned too, so you did some more postdoctoral classes and courses, seminars
Hmm.
regarding more of that, like prenatal care and pregnancy care. One of those being the Webster Technique, correct?
Yes.
Yeah. So could
Yep.
you kind of share a little bit more about that? What that is? What kind of what the goal is using those techniques, and that would
Totally.
be great.
Of course. Yeah, so I did additional training through the International Chiropractic Pediatric Association, and they're the ones who certify chiropractors in the Webster technique. In my opinion, and in the opinion of most perinatal chiropractors, the Webster technique is the standard of care during pregnancy, and that's the technique that should be used for on pregnant mamas. I use it pregnant, and then through pregnancy, and then usually up until like a couple months postpartum before I add anything else back in. I'm going to read you the official definition of the Webster technique.
Perfect.
Let's see here. So the official definition, the Webster technique is a specific chiropractic sacral analysis and diversified adjustment. The goal of the adjustment is to reduce the effects of sacral subluxation or SI joint dysfunction. In doing so, neurobiomechanical function in the pelvis is facilitated. So that's just like a really fancy way of saying it's a specific analysis of the pelvis and sacrum, as well as the uterus. So we are looking for specific markers, different things like that, and then giving very specific adjustments to the pelvis, to the sacrum, the SI joint, and then also looking at other muscles and ligaments. So I evaluate the piriformis, the sacrotuberous ligament, uh, and that's all with the patient lying prone, so face down. And then when they're lying supine or face up, we are going to be analyzing their pubic symphysis, which is the anterior connection point of your pelvis, and the round ligament, and the psoas. So those are kind of like my 6 checkpoints that I'm always checking. Sometimes there will be other things, added in there. But yeah, so those are the, joints, muscles, and then ligaments that we're evaluating, which are super important. And I was just actually talking to a patient about this today, how even like subtle biomechanical changes through the pelvis and uterus can cause like different torsions. And we know that there are ideal positions for a baby to be in for better birth outcomes. And our society right now, and just the way that our world works even more now, with people working from home and sitting even more in front of their computers than they were before, or just staying home because we're not doing a lot of stuff right now. People are just sitting a lot. and sitting is not the best. At least the way most people sit is not the best for getting your baby into the proper position or the ideal position before you give birth. So we're kind of just trying to make space for the baby and facilitate, facilitate good positioning, which hopefully is going to lead to better birth outcomes.
Mm-hmm.
So,
For listeners, if there was someone listening curious about like what positions that would be, obviously if they're not able to do the technique themselves, but anything that would potentially help kind of either get them ready to go see someone that would do the technique, or just if they don't have access to that, what would be something that they could potentially do?
right, totally. So I'm also a spinning babies aware practitioner, so I've taken additional training in spinning babies, which is an amazing, amazing modality of like body work and body balancing. And a lot of the things with spinning babies you can do from home. So there's called the Three Sisters of Balance. And you can Google it and look it up, but there are 3 different positions. They do require, 2 of them require like a partner. So your spouse or your friend or one other person. But there is the side lying release, forward leaning inversion, and rebozo sifting, which is using like a scarf.
Okay, I've seen that one before.
Yeah. But those are 3 that I recommend to all my patients, usually about in like right before the 3rd trimester, in like the mid 2nd trimester, I teach them those exercises. And then, Spinning Babies has amazing resources and a lot of stuff that you don't have to be a chiropractor to do it. You don't have to have any special training. You can watch some YouTube videos. Of course, it's nice to like have somebody who knows what they're really doing.
Coach you through it a little bit. Yeah,
exactly. But that would be a great resource for your listeners if they aren't able to get to, someone who is Webster certified or things like that. And then they have a lot of, they call it smart rest positions, which is like a sleeping position. And then just being super mindful of your positioning when you are sitting and not like slumping back and you create like a little hammock for your baby, right?
Yeah.
You want to stay a little bit more upright, to keep them in a good position there. So,
awesome.
That would be I would say start there for sure.
Perfect. Yeah. That sounds like a very helpful resource for many people with that.
Yes.
Question that, so with my specialty, seeing a lot of women postpartum, I have a lot of conversations, a lot of opportunities to educate. And a lot of the times, regardless of what I'm talking about, someone will say like, I wish I would have known that sooner. What topic do you feel like has been either something that continues to come up for you in your practice, or something that just kind of in general has been something that you'd like to share for listeners that they can maybe know sooner rather than later?
Totally. I feel like I have 2. And one I kind of touched on earlier is just that like pregnancy doesn't have to suck. And I think, I don't know, in our society or just like the way we talk about women's health or what, everyone kind of tells like their war stories, like, oh my gosh, like blah, blah, blah. This happened to me. And it doesn't have to be like that. It really doesn't. Not to say that like, it's going to be like, oh my gosh, amazing all the time. But, like you don't have to suffer in physical pain during pregnancy. Like there are things that you can do. There are resources. There are people who can help you, to really enjoy your pregnancy. And I've had, countless patients who unfortunately aren't getting their baby is cared for prenatally, and like everything's fine with their baby, and like you're just going to have back pain, or I've heard you'll be in a wheelchair because you have SPD or symphysis pubis dysfunction so bad that you're going to be in a wheelchair at the end of your pregnancy. And I'm like, what? Like before you tried anything else, you haven't seen a pelvic floor specialist, you haven't seen a chiropractor, you haven't done massage, you haven't done acupuncture. Like yoga, there's so many
So
things. And
much.
they're just like, you're going to be in a wheelchair. I'm like, what? This is crazy. But yeah, so to just empower people to know that there are safe and effective things that they can do during their pregnancy, to really enjoy it. And I'm not saying everyone will, because sometimes things are pesky, and they don't really go away. But at least to try and find something that might work for you.
Mm-hmm.
Yeah, I recently had a patient who was just like, oh, I don't like being pregnant. And I saw her one time. The next visit, she was like, oh my gosh, like I didn't know pregnancy could be like this. Because, like the first trimester is kind of like, you just kind of feel lousy. Or
Mm-hmm.
not everyone, but it's pretty typical to feel nauseous, and really tired and things like that. She was just like, in the second trimester, she still kind of felt crummy and her body was hurting. And she's like, I didn't realize that pregnancy could be like this. And I'm like, oh my gosh, like, I'm so glad you came to see me. Like,
For sure. Yeah.
and it was on her husband's insistence. He was like, we need to do something for you. Like, he was like, men,
There's
they're
too much more
fixers.
time. Yeah.
Exactly.
There's too much more
They're
time.
fixers. And he's like, I got, 5 more months of this. So yeah, we're super excited that they found us. And then, oh goodness, did I lose it? Oh, Lindsey.
That's okay.
Okay. It'll come back to me and
It'll
then
come back to you.
yeah.
But we were talking about too earlier about, like, you were mentioning the fact that you've had some patients come to you as seemingly their last resort or something, but having more of a team, like you were saying, of a team of people. And what does that look like, or who would you recommend? You kind of mentioned a few things of just having like more people in your network, whether that's during pregnancy, after pregnancy, all of the above. Who are those people that you want in your corner?
Yeah. So I think especially right now, people need people in their corner, because that village of, just like having those girlfriends and people who are, going through the same season as you, uh, it's not as easily accessible right now.
Mhm.
And so I feel like those people are pelvic floor physical therapist, an acupuncturist, a perinatal chiropractor, so a Webster certified chiropractor, massage therapist, yoga instructor, YouTube. You can YouTube prenatal yoga. And I have done that. I mean, what I thought my pregnancy was going to be like, doing all of these things to take good care of myself, it hasn't really. I'm still taking really good care of myself, but like I wasn't going to prenatal yoga, for the first 30 weeks. So I was doing it at my house, and I'm not really a yogi. So I just found something on YouTube, and I looked at the lady's credentials and was like, okay, and then also just listening to my own body. But yeah. And then I think, having, I personally am under midwifery care, which has been amazing. And I know that that's not accessible. A lot of this stuff isn't accessible to everyone, because most of it does have a cost to it. But I've been under midwifery care, and just the contrast between what I am hearing. I've never been under obstetrical care during a pregnancy, at least. The contrast of what I am hearing from my patients that, see OBs that are great and loving and awesome, but just the difference of care it's bar none. My midwives are amazing. Shout out to Beautiful One Midwifery. They're awesome in North San
Awesome.
Diego.
Yeah. Yeah.
But yeah, just the emotional support that we've received, for both myself and my husband, and then the level of autonomy and like shared decision making, informed consent that I've had during my pregnancy. It's just like, I'm like, this is what everyone should have. My appointments are an hour long,
Oh, that's
and
good.
probably 15 minutes is like clinical, where they're measuring the baby and we're listening to the heartbeat and doing stuff like that. And the rest is, counseling on nutrition, and, my mental health and just different things like that. So that has been really, really awesome. So having a care provider that you trust, and that you can converse with and actually have a conversation and ask questions to, has been just super, super wonderful. So I would highly recommend, interviewing who's going to be caring for you during your pregnancy rather than just going with whoever you're assigned to or whatever.
That's
Yeah.
that's a really big one.
Birth
Mhm.
doulas, awesome. Postpartum doulas, we are
Yes.
considering, we don't have one hired yet. We do have a birth doula, but we're considering a postpartum doula because my husband will be going back to work relatively quickly to care for my patients and his patients.
Yeah. He'll be busy.
So
You'll all be busy.
we will all be
Yeah,
busy.
we'll all be.
So, and then, the support that we were hoping to get from family is going to be less just because of, the weird time that we're in right now.
Circumstances.
So exactly. Yeah. So I don't know. Does that answer your question?
Mhm.
We went
Yeah,
on a major
for sure.
tangent there.
No, that's good. Tangents are good. Tangents are good. I think it's so cool to hear though that, I mean, being aware of the options that you have, being aware of like building your village. And I think I've been around a lot of women that are pregnant or expecting or postpartum and just different things about how you can actually like create that for yourself and for your baby, and how it is about the mother. And I think it should be more like it's so important with the baby. Obviously it is.
Of
It's a
course.
new life, it's a baby. Um, but to not say that the mom doesn't also get to have some benefit from it, or to have, you know, the village around her as well, and having that support system. So I think it's huge, and awesome that you kind of laid out a few really awesome recommendations for people to find what resonates with them and what that looks like for them, and whether that's, you know, if they're looking for a certain thing or who can be in their corner. So I think that was really helpful
Totally.
information.
Well, and I feel like having those other providers, a lot of times the visits with those other providers are a little bit longer than what you would get with your OB, and then sometimes are more frequent, because typically with an OB with like a physiologically normal pregnancy, you're probably not going once a week until the very, very, very end, 36 weeks plus. Otherwise, you're seeing them every other week or even once a month. And so to have people who have resources, who can answer your questions, I'm constantly like, well, what did your OB say? Oh, I forgot to ask, or like they were in and out really quick. I didn't have a chance. And it's such a bummer, but I'm also super grateful that I can be a resource for them. Just like I'm sure this happens in your practice as well,
Mhm.
of just like, I'm sure like the 6 week,
Yeah.
follow-up visit. Oh, they said I can have sex again. And it's
Yep.
like, oh my gosh, it's so much more than just that. Right.
Mhm. Absolutely.
Yeah. And they're not addressing, all the other things, or even making the referrals or recommendations of like, well, you're good on this aspect, but like, let's work through this and let's get you to this provider so that we can get you back to, or get you in a place of like not dysfunction.
Mhm. Yeah,
Yeah,
supporting and being able to even like build that foundation to set you up for success. I think sometimes people think
totally.
this is my normal, whether that's, you know, back pain during pregnancy or leaking postpartum or things like that, where it's
Right.
like, okay, yes, that can happen, but that shouldn't be what you're expecting, and
Right.
like thinking like, oh, well, this is just what it is. Like
Right.
that there's a reason why there's people in this world that are dedicated to work with new mothers and
Right.
women that are pregnant and all of those
Right.
things, because we know that there's a better option. And so
Totally.
that's why I
Well,
wanted to start this podcast, to share that with everyone, with
so
everyone.
good. And and I'm sure you're saying this too, um, just because it's common doesn't mean it's normal.
Exactly.
Right. And I feel like in pregnancy and in postpartum, there are a lot of things that are common, but are dysfunction. They're
Mm-hmm.
not normal, physiological, the way your body's supposed to work. And you don't just have to like accept it. like there are things that you can do to help yourself. So yeah. And I feel like having, even just like one of those people in your village, like they know people,
Exactly. Yeah.
and so like, you don't need to know all of these people. Like you just
Mm-hmm.
need to know maybe one or two, and then ask them, for
Yeah.
resources. We're constantly referring back and forth, which is awesome. So
Mm-hmm.
yeah,
It helps. That's so good.
I remembered my other
Oh, good. Good.
I wish I would have known. And
Yeah.
it's so simple, but I am constantly teaching people how to do a log roll.
Oh, I
Um,
have a video on my YouTube. I'll share. I'll
okay,
put it in the show
sweet.
notes.
You
Log
should.
roll. I will.
Yes,
Log
because
roll.
and I always tell them, I'm like, doing a sit up to get up is not going to hurt your baby, right? Your baby's going to be fine. But when it comes to postpartum healing, you are doing yourself a disservice, and you're putting a lot of strain and stress on that fascia that's already strained and stressed.
Mhm.
So do a log roll, and it's
Yeah.
also not helping your lower back either.
Exactly. Yeah.
I'm like,
It's
it's
like
not going to hurt your child, but like just roll to your side and come up that way.
absolutely. Yeah. Listeners, I will put my video in the show notes so you can see how to do a log roll.
Yes.
Because game changer for many people, and for some of the older men out there. I feel like if they have a little bit of a belly,
Yeah.
you can see the diastasis is real for many gentlemen too.
Yes.
It's not just for the pregnant women.
No, it's not. I teach it to, I would say, almost all of my patients, particularly if they're having lower back pain.
Mhm.
I'm just like, we're getting up out of bed, you're getting off the floor, you're getting off the sofa if you were laying down, like this is how you should be moving.
Mhm.
And it's so simple, but it makes a big difference, because it's something that you're doing every day, at least once,
Yeah.
So yeah.
That's perfect. That's perfect for like longevity, as well as just like taking care of yourself in this time, in this season, wherever you're
Totally.
at. It's going to be helpful. Just start doing it now, because your body's going to thank you years down the road.
Totally. That's exactly. I'm like, you're not going to hurt your kid, but you will
Mhm.
be so glad that you did this, and
Mhm.
really this is the way we should all be getting up,
Yeah.
So
Movement habit for sure.
yes,
For
definitely.
sure. So I wanted to see so you had mentioned you're really into some more of that prenatal yoga right now.
Uh-huh.
What other like exercise movement stuff did you like to do prior to pregnancy? And then what does it look like during your pregnancy? And like what's bringing you joy right now through movement?
Totally. I love that. Well, I am trying to be as active as I can. And typically, so what that looks like right now, I go to prenatal yoga with actually someone who, Liza Janda,
Yeah, yeah.
who
She was
you
on the show.
interviewed.
Mhm.
Yeah. Yoga in the park. And it's so nice. We're all, socially distanced, but it's nice to be around other pregnant moms that are
Mhm.
kind of in the same season. And so that's been awesome. So I've been doing that once a week. And then I usually do 2 mornings a week. I'll do yoga just at the house, some stretching. Spinning Babies has something that they call the daily essentials, which are just like stretches, yoga poses, lunges, squats, different things like that. So I'll kind of run through that. And they're all things that are, helping to prep for birth.
Mhm.
And then I've been walking for about an hour, like 4 times a week.
Nice.
Yeah.
That's
So
good.
3 to 4 times. If it's super hot, it might not happen that day. So
Yeah,
then
it's been really hot lately.
oh girl, being this pregnant, it has been so hot.
uh, my
Yeah.
uh, kudos go out to all the pregnant moms out there right now in this
Yes.
heat.
Oh my goodness.
You ladies rock.
Yeah.
Keep it up.
Um, no, I've hit my moment like twice. I was just like, Mike, I have to leave our house without air conditioning. But yeah, so those are kind of the things that I've been doing myself. Sometimes I'll throw in, like an upper body with some weights and things like that, but haven't been doing a ton of lifting. And before I was pregnant, I was doing Legree, which is like a
Mm.
Pilates based fitness exercise. And love that. But then with all the shutdowns, they were closed and then they opened back up for, those couple weeks.
Mhm.
They've been open outside, but again, it's hot. So I haven't been going.
Yeah.
But really, really, really awesome uh, exercise routine to do during pregnancy. And you do have to make some modifications, but most of their instructors are well versed. And then I also am fortunate enough to know like what I should and
Mhm.
shouldn't be
Modify,
doing.
yeah.
Exactly.
Self-modify.
Yeah. So there is a lot of core exercises. And I know there's obviously some things that you can do to work your core while you're pregnant, but a lot of the exercises that they're doing aren't good for pregnancy.
Mhm.
So usually I'll talk to the instructor before class and figure out what arm moves they're doing. And then I just do different ones. So I do like double dose of arms.
Gotcha. Mhm.
Yeah. And so it's lots of lunges and squats and it's all time over tension, really slow movements, which is really, really, really awesome. So I don't know. Part of me is like, oh, I want to go back a couple of times, but now I'm like, oh, I'm very pregnant.
Mhm.
So I don't know. I might get back out there.
Yeah.
Yeah. So that was what I was doing 2 to 3 times a week before, well, in my early pregnancy, like the first trimester, I was doing that.
Mhm.
But yeah, so I look forward to getting back to it postpartum. So
Yeah, and hopefully at that point too, things will be open and not necessarily outside. Hopefully, cross our fingers
totally.
that
I know. And
that'd be the
normally I'd
case.
be cool to do outside and I've been doing yoga outside, but
Yeah.
um yeah, it's just like really hot.
Mhm. Absolutely. Yeah,
It'll
for
cool
sure.
down a little bit, right? I hope.
Yeah, yeah, it should. It should by then. I think it's such a good highlight though to talk to the instructor if you're doing group exercise. And I think there's some more awareness that more trainers are more aware of different modifications and different things like that, but also just letting them know or letting them know that you might do something different, I think is so, because it's showing them respect too, that they're not like, why is that girl completely doing something different? And then like they're focusing on like, why is she doing that wrong? When it was like, no, I'm not going to do this, this
Right.
crunch or like this, like bicycle thing or whatever, because you don't feel comfortable doing it, or you just know that there's a safer option for you right now, or whatever that is. I think that's like across the board, even if like you're going to a class and you have like a shoulder injury, like just being smart about it. Don't try to power through, but
Totally.
let them know.
Yeah. Definitely. Yeah.
That's
And
cool. Yeah.
all of them they're always like, "Oh, do you need some suggestions?" And so, yeah, I think just being transparent is like you said, being respectful of them, but then also like being respectful of your body and not just being like, "Oh, this hurts so bad, I'm going to keep doing it." It's like,
Hmm.
"No, if something is not working for you, ask for help. Hey, am I doing this wrong?" If they come and give you a correction, you still aren't able to like do it properly without having pain. Okay, can you give me something else? You
Hmm.
know?
For
So,
sure. For sure.
yeah.
Awesome. So, Sam, I wanted to transition into one of our final questions that I ask for every guest that we have on the show. So, we're pretending that you are leaving your favorite coffee shop, which is Steady State. Or
Yeah,
what's your favorite
probably.
one around here?
I think Steady State is
Yeah.
probably
Shout out to Steady
probably the
State.
fave. Yeah,
That's
they're
one of
so
ours
good.
too. Yeah. So you're leaving Steady State. You have a morning full of patients that you have to see, but there's a new mom that reaches out to you and she taps you on the shoulder and she says, "Hey, Dr. Sam, I have a question. I'm really struggling with staying healthy and like finding my new routine as a mother. What advice would you give?" And you have like just a minute
Right.
to share that before you run back to the office.
Right. Oh man. I feel like the biggest thing, and maybe I'll come back on the podcast once the baby's here,
Mhm.
and give you a different answer.
Yeah.
But
Updated.
um like good for them on asking, you know, and find people who can support you. Are you getting enough rest? You know, like do you have help? Uh and help doesn't need necessarily mean like, people coming in, but like, do you have an 30 minutes where your spouse or partner like has the baby and goes for a walk and you have 30 minutes to yourself, whatever you want to do during that 30 minutes. And I've been seeing this like meme going around that like basic hygiene isn't self-care, which is like,
Mm.
have you seen that? Oh my gosh.
I'll have to look it up.
Yeah. It's like, it's talking about postpartum,
Mhm.
health and things like that, and how like taking a shower is not self-care. Like that's like basic
Yeah.
hygiene. It's not like mom taking a break is like, oh, I get a shower. Like, no, that's like a very baseline, foundational thing that we should all have.
Mhm.
But yeah, and I would just say, don't be afraid to reach out to whoever your crew is. And a lot of times right now that is online and like these Facebook mom groups and different things like that. But to find that crew of people that you can be authentic and 100% yourself with. And don't be afraid to reach out to them. Like people want to help other people. Yeah. And I guess one last thing is like, are you eating nutritious food?
Mhm. Yeah.
That's like, throw that in there.
Yeah.
Yeah. During that, initial postpartum healing phase of, if you're not giving your body sustenance, that's actually, gonna help you heal. You can be doing yourself a little bit of a disservice. So, whatever that might look like. So is that people bringing you meals, or you remember those freezer bags that you prepped? Like, have you taken them out, or
Yeah.
put that on the to-do list for your husband before he leaves for work, take that out, put it in the crock pot, yeah, those would be kind of my big ones.
I love
Um,
that. She hit the jackpot asking you. That's some good advice.
that was more than a minute. I'm going to be
That's
late to my
okay.
patients.
Yeah.
I was helping a
You're like,
mom. Okay.
you're running. You're like, wait. Oh, that's so awesome. Well, I would love for listeners to know where to find you. If they have any questions or if they want to come see you, maybe not in the next couple of months necessarily, but if they want to come
Right.
to Foundation Chiropractic where you work. So where is a good place for people to get a hold of you?
So probably our website, which
Okay.
is www.foundation or .foundationcarlsbad.com, would be a good one. And then we're on Instagram. We're not really the best Instagrammers, I have to say, at Foundation Carlsbad, but you can find us on there. Like we check the DMs. Not super good at posting. I don't think I posted anything during this entire pregnancy. I think we posted the pregnancy announcement. That's
Yeah.
probably it. And
That's justifiable.
exactly. Yeah. And and then you can always reach us, at the office phone number. Do I give that?
I'll include it all in the
Okay.
show notes. Yeah.
Perfect.
I can
Awesome.
find that.
But yeah, that would be the easiest. Or you can email us to foundationcarlsbad@gmail.com. Which is
Perfect.
super easy. Yeah.
Perfect. I'll
So
link all that up in the show notes for listeners.
awesome.
Perfect. All right. Sam, thank you so much for being on the
Ah,
show.
Lindsey, thanks for having me.
It
It
was
was
so good to
fun.
connect. It's been a while since I feel like the last time we
I
had grabbed
know.
coffee. It feels like it's been like years.
I
Um,
know. And we were supposed to do our thing in person. We'll do
I
it
know.
eventually.
We will. Yeah. I have hope that there will be a time where we can do more things in person with more
Yes.
people.
Yes.
I'm super excited for you and your growing family, for you and Mike and the baby on the way.
Thank you.
Looking
Thank
forward to
you.
updates on how that all goes. But again, thank you so much for being on. That was so fun. So fun.
Awesome. Thanks, Lindsey. I appreciate it.